And we have a really perfect speaker to really round us out here at the end of our event. So Judy Fitzgerald she's a breast cancer survivor, and she's a big time patient advocate now. She was diagnosed with breast cancer in 2008, and she's been working very diligently on prevention for breast cancer pretty much since then. And she's had a lot of accomplishments. She's got a great website and a great organization called Sisters for Prevention. And she's also got a bunch of really great YouTube videos on her YouTube channel where she interviews different patients and patient advocates. And there's a lot of really great information on there. And we're really lucky to have Judy talk to us today about complementary care. I will pass it over to Judy and let her take it away.
Thank you, Andrew. I'm honored and blessed to be here today to provide the patient perspective on the importance of integrative medicine in cancer care. I am very grateful to NCI and NIH for this invitation. So my disclosure is that I am an advocate for the phase 1 clinical trial for the TUI breast cancer vaccine at the Cleveland Clinic, for which I'm a passionate supporter and advocate. Hopefully someday prevention will be the cure, and we'll be able to give the vaccine that has been so long in coming. So I am not a medical professional, nor do I claim to be. The information I'm going to present you was gathered by personal research, attending cancer conferences, and engaging in interviews with other cancer survivors. When I was diagnosed, I was advised as part of my treatment to keep a journal. And in that journal, it was very helpful for me to look back on later, because sometimes when you are over treatment, you second guess the decisions that you made. But by having a journal, you could look back at that time and say, I made the best decision I could with the information that I had. I also kept a journal with all of the research and tips I had for trying to prevent my own recurrence. And these are included in my book, The Teacher's Journey, What Breast Cancer Taught Me. So how did it happen? Well, 2009 was the year I became the 1 in 8. I was diagnosed with bilateral breast cancer. So sadly, the statistic now is 1 in 8 women will get this disease. But unless we get it under control, it is projected to go to 1 in 4 within the next 20 years. So when you're diagnosed, there's so many questions. I remember feeling a deer in the headlights. Why or why not? I had no cancer in my family of any kind. But then the more I did my own research, I realized that no one is exempt, that this disease has become so prevalent that you don't need to have a genetic predisposition to have the diagnosis of breast cancer. And then, of course, you start second guessing yourself. Did I do something to cause this? I was a chemistry major. Maybe I handled too many chemicals. And also, what can I do to empower myself to help prevent recurrence? A lot of patients feel with a cancer diagnosis that somehow they've lost control. And so the way to take back that control is to educate yourself and implement some strategies to help prevent the disease. And then, of course, my passion was, what can I learn from other survivors, especially those that were given diagnoses and lived many, many years a healthy life. And then the paradigm finally has changed over the 14 years since I was diagnosed. Can we really actually prevent this disease? Not just early detection, but primary prevention, so the disease never happens at all. I will talk more about that later. So the main lesson that I learned was I basically needed to strengthen my immune system. Okay, so Long-term survivors, I found, took a holistic or integrative approach. They made diet and lifestyle changes to make their bodies unsuitable for cancer to survive. One author wrote, "The garden of the body is the soil that is we need to make unsuitable for the cancer cells or the weeds to occur." So, what is a holistic or integrative approach? Well, to gain good health, there's so many components that we often don't realize are part of this picture we call optimal or good health. There's diet, reducing stress, hormones, genetics, if you have a predisposition, medications and supplements we may take. Of course, we just talked a lot about exercise. Eliminating toxins, keeping a healthy digestive system and gut biome. Sleep is so important. And I know many of us in this crazy world don't get enough sleep. So what the holistic approach looks at is they're treating the whole patient. They're treating the body, not just the disease. So they're connecting the mind, the body, and the spirit. I really like this quote from the World Health Organization, which I was shocked, goes back to all the way back to 1948. So we've known about this for a really long time. That health is a state of physical, mental, and social well-being, and not merely the absence of disease or infirmary. So basically, everything has to come together for people to really enjoy good health. So we heard these definitions earlier, but I just wanted to put them in context of a cancer patient. So the conventional approach is you do nothing else except follow the advice and care of your doctor. The alternative approach is that you don't do any of that. You don't have surgery, chemo, or radiation, and you decide to combat your cancer with natural products. The complementary approach means that you can use complementary strategies along with mainstream medical treatment, but it's not itself to be considered standard of care. Patients include standard of care, but they add the holistic approach to support their mind, body, and spirit. And the integrative approach is the best of all. That's when the medical team actually works with the patient, and many centers have this available now, so that they offer both types of care to the patient. So in addition to receiving chemotherapy and radiation or surgery, they're given access to acupuncture, to yoga, to Reiki, Tai Chi. And so that's really addressing the whole body approach. Now, the conundrum for the breast cancer or any cancer patient is it safe to deviate? And what if my doctor doesn't think that I should do that? So let's take a look at this quote from Breast Cancer Now. And they say, with the right therapy and therapist, you may find, as many people do, that complementary therapies can offer the much needed extra support before, during, and after your treatment for breast cancer. So they are endorsing this theory. Okay, well, what happens and why do we get cancer in the first place? Why is our immune system not able to get rid of cancer before it gets started? Well, we're going to do a little bit about genetics, back to high school biology, just a tiny bit, just to explain. So an acquired gene mutation is not inherited from your parents. Instead, it develops at some point during a person's life. Acquired mutations occur in one cell, then are passed onto any new daughter cells that come from that cell. The mutation cannot be passed on to the person's children because it doesn't affect their sperm or egg cells. This type of mutation is referred to as a sporadic mutation. Acquired mutations can happen for different reasons, and this is what's important to our discussion. Sometimes they happen when a cell's DNA is damaged, such as being exposed to radiation or certain chemicals. But often, these mutations occur randomly, without having an outside cause. During the complex process when a cell is dividing to make two new cells, the cell has to make an exact copy of all of its DNA. And sometimes mistakes happen and mutations occur. Every time a cell divides is another chance for a gene mutation to occur. This number of mutations in our cells can build up over time, which is why we have a higher risk of cancer as we get older. And I have a quote from the American Cancer Society that says, "Acquired gene mutations are much more common cause of cancer than the actual inherited mutations." My cancer was classified as environmental. And so the thought was that I had been exposed to either radiation or having worked in a computer lab or chemicals from when I was a chemistry major in college. So, let food be thy medicine and medicine be thy food from Hippocrates. So Anne Fonfa, excuse me, who's a great friend of mine, is a 22-year cancer survivor. And she's been a proponent of this since her diagnosis. She's got 3 steps for health. And she says simply, eat more fruits and vegetables, go out and take a walk, and take deep breaths, which is what we just did with the exercise. Now, this looks very ominous, but I assure you it will make sense and we'll tie it all together. So I call this my wheel of wellness. So we'll start at 12 o'clock with berries. Berries are one of the most important foods that you can eat, actually, to combat cancer. They're a powerhouse of antioxidants, which include flavonoids and anthocyanins. They have been shown to protect against cellular damage, as well as the development and the spread of cancer cells. And we're going to talk a little bit about organic or non-organic. It's very important to buy berries that are organic because non-organic berries are sprayed with a lot of pesticides. Maintain a healthy BMI. Your body mass index is calculated by taking your weight divided by your height squared. NIH actually has a BMI calculator you can use to easily find your BMI. An ideal BMI for a body that is not susceptible to cancer is under 25. So when to buy organic? In this day and age when food is so expensive, this is a great, great challenge. Well, each year, the Environmental Working Group posts the Clean 15 and the Dirty Dozen. You can go to their website and you can actually go on and print out the Clean 15 and Dirty Dozen and put it in your cell phone so that you have it when you're at the store. And they list, for the Dirty Dozen, they list at the top from most contaminated to least. And you will find berries are there at the top. So when you're looking for organic produce, stickers start with a 9 and have 5 digits to follow. Conventional only have 4 digits and start with a 3 or 4. So when you are grocery shopping, if you can afford to buy the Dirty Dozen in organic, that is the optimal plan. The Clean 15 are not needed to buy organic. And also, if you have to buy something that's in the Dirty Dozen, try to stick to the bottom of the list. And you can actually help remove the pesticides in washing them. Fill your sink with water and add a cup of white vinegar or apple cider vinegar and let them stay for 10 minutes and then rinse thoroughly. And then it does help to remove a lot of the pesticide residue. So green tea, the importance of drinking green tea, and I want to emphasize here also staying hydrated and drinking a lot of water. But green tea has actually been credited with preventing cancer. It contains a compound called epigallocatechin gallate, which is actually referred to as EGCG. It inhibits, the growth of cancer cells by binding with an enzyme called dihydrofolate rectinase. Scientists also researched the structure of EGCG and found it's very similar to methotrexate, which is actually a cancer drug. Fiber and gut health. I attended a very interesting seminar on this at San Antonio. So in the era where we've had so many antibiotics, sometimes we need to replenish our fiber and gut health. Bacteria, viruses, fungus, and other microbes that are naturally found in the gut can influence treatment response either positively or negatively. International researchers have found that the gut microbiome can shape how patients with cancer respond to immunotherapy, which makes sense because your gut biome is an integral part of your immune system. This follows, obviously, that we need to keep our gut healthy. If you find that I guess you can get a test, but the way to just be sure is to take probiotics, eat fermented foods like kimchi, sauerkraut, and kombucha, and that will help to replenish your gut biome. Avocados, I have to admit, before I was diagnosed, the only time I saw an avocado was at a Mexican restaurant. But since I was diagnosed, avocados have become one of my favorite foods. Avocados are rich in monosaturated fats, which raise the level of good cholesterol while lowering the bad. Avocados are also packed with benefits of vitamin E, which help fight free radical damage. We talked about that with the cell changing. It boosts immunity and acts as an anti-aging nutrient for your skin. Other healthy oils that are monosaturated are coconut oil, olive oil, and of course, avocado oil, which I do use all three of them in cooking. And coconut oil, believe it or not, does not affect the taste of food. And it's also very stable at high temperatures. Mindfulness. Mindfulness, we already talked about in the last session with the exercise. The basic rule of mindfulness is be present in the present. That's the old saying where the present is a presence. So be is a present. So what happens by being present in the moment is that you don't dwell on mistakes of the past and you don't worry about the future. So that's really important for cancer patients because the fear of recurrence is always on our mind. So by staying in the present, we enjoy the day that we're in and don't let our minds wander. This helps to relieve stress. And as we saw, some of the methods are yoga, Reiki, meditation, acupuncture, and other things. So relaxation techniques. I listened to a podcast when I was diagnosed by Bella Ruth Nussbaum, and she actually had a visualization video that you would visualize your body eating up the cancer cells. And that has actually been something that they've kind of been looking at. Quality sleep and melatonin. When I was diagnosed, there were studies going on with the Nurses' Health Study 2, where they were finding that nurses who were on third shift were getting more breast cancer than their day counterparts, and they couldn't figure out why. And what they found was that since estrogen stimulates the majority of breast cancers, anti-estrogenic agents like melatonin have found their way into breast cancer studies. My oncologist had actually done such a study and actually prescribed me 20 milligrams of melatonin, which I still take 14 years later. I have no trouble sleeping. And I'm hoping that I am doing something as an anti-cancer as well. Cruciferous vegetables. These are also your best friends. These are named for the shape of their flowers, whose petals resemble a cross. They include broccoli, cabbage, cauliflower, bok choy, kale, Brussels sprouts, among others. These foods are rich in vitamins, minerals, and fiber, which is thought to help protect against cancer. Cruciferous vegetables are rich in several carotenoids, beta-carotene, lutein, and xanthan, vitamin C, E, K, folate, and also sulforaphane, which has powerful anti-cancer effects. There's much chatter on breast cancer sites. There's a supplement you can buy called DIM, D-I-M, and it basically is made from broccoli. So if broccoli is not your friend, you might want to do this, but it's also always best to get it from the original source. So red meat and dairy. The natural diet of a cow is grass, and grazing on pasture is an important natural behavior for cows. However, the vast majority of lactating dairy cows in the US, as much as 80%, are not kept on pasture, but are housed indoors and fed soy and corn, in addition to increased milk production. These cows are also given hormones to help with milk production. That's why it's so important to buy beef and dairy from pasture-raised animals and limit the portion size to the palm of your hand. Don't be fooled by labels that say all natural meat. If you think about it, all animals are natural, but it doesn't mean they were raised sustainably. Plant-based diet does not actually necessitate veganism. As long as you cut back on meat and follow some of the other tips, it's really not that hard. I gave up milk, dairy products altogether when I was diagnosed. It was based on some reading that I did. And with all the options now for different nut cheeses and nut milks, I don't find it a great hardship. But again, if you're going to have milk and meat products, please make sure it says that they were grass-fed, pasture-raised, and especially milk that we're feeding our young children. So mushrooms. Mushrooms are so important because they cause cancer cell apoptosis. Apoptosis means the cancer self-destructs. So it can be used in forms of extracts or powders. They contain a high concentration of active compounds such as beta-glucan, which works by triggering changes in our immune system. These changes include the activation of immune cells, increase antibody production, and reduce inflammation. So they are really important. Again, if mushrooms are not your thing, then there are excellent mushroom supplements on the market that you can take. And I was really interested when I was first diagnosed, because I had HR positive, HER2 negative breast cancer, that mushrooms were like a natural tamoxifen. Excuse me. So we're getting closer to the top. We just did a great job about exercise, so I'm not going to go through that, but I am going to mention that exercising outside has a double benefit in that you would be intaking natural vitamin D. And vitamin D is actually measured recommended to be measured by cancer patients, because low vitamin D levels is associated with bad outcomes. So some of the benefits, if we're talking complementary about exercise, first of all, estrogen is stored in fat cells. So if you have an ER positive breast cancer, you definitely want to try to reduce your body fat content. It also helps with some of the side effects of chemotherapy, like fatigue, weight gain, osteoporosis, and lymphedema. And it also helps reduce your risk of heart attacks and strokes. It increases your mental well-being and prevents or reduces the loss of muscle tone. And last in our wheel, I'm getting ahead of myself. So the next one, avoid chemicals and personal care products. A lot of the personal care products, particularly makeup and lotions have endocrine disruptors, which some of them are outlawed as of this day. We have a long way to go. So an endocrine disruptor is the chemical structure of one such ingredient, which is parabens. And parabens acts in the body similar to the hormone estrogen. Research has shown this estrogen mimicking product has been greatly linked to cases of early puberty in girls. Over time, endocrine disruption can lead to a variety of problems, including acne, male breast cancer growth, development of neurological disorders, and various cancers. Studies have also shown that parabens can alter thyroid hormone levels, causing other health effects. A great concern with this is that the cheaper products, the less expensive makeup and lotions, are the ones that are normally preserved with parabens, phthalates, and other chemicals. And so it's of great concern with our younger women coming up that they're being exposed to these chemicals. And last but not least, spices and herbs. Herbal tea, traditional Chinese medicine recommends a lot of herbal tea. But two of the spices that I want to focus on are turmeric and ginger. Turmeric is found in Indian cooking, and this bright orange, colorful powder is known as the king of anti-cancer spices. Turmeric contains the ingredient curcumin. Curcumin has been shown to inhibit the growth of various cancer cells, including bone, breast, brain tumors, colon, liver, pancreatic, stomach, bladder, kidney, prostate, leukemia, ovarian, and melanoma. Turmeric is known around the world as an antiseptic and antibacterial agent to also treat inflammation. So if you are not partial to Indian food, you actually can get this also in a supplement. And this was the first thing I started taking when I was diagnosed with breast cancer. And it was in conjunction with my healthcare team. And ginger is also a powerful house for anti-cancer. It contains trace minerals such as calcium, iron, magnesium, manganese, phosphorus, potassium, sodium, and zinc. It also contains numerous vitamins, including thiamine, riboflavin, niacin, pantoic acid, vitamin B6, folate, as well as vitamins C and E. So this wheel of wellness, when I was first diagnosed and started my advocacy work, I was asked by Patch.com to do a post for breast cancer month. And I named it 31 Days of Prevention. And what I did was I took 31 days and I did a blog every day, starting out with very simple things like drink more water. And secondly, get out your sneakers and get walking. This is also on my website, prevention.com. So back to Annie Appleseed, because she is holding an extraordinary conference in in West Palm Beach, February 23rd to the 25th. I have attended this conference many times. Unfortunately, COVID made it basically impossible for the last couple of years. And this is geared for patients and survivors or patients going through treatment that have a stage 4 diagnosis can actually apply for a scholarship. Okay, this actually is something that is sort of all the rage on the internet. Intermittent fasting is a new trend for weight control, which limits a daily eating window to 8 hours. Basically, it's meant to go with your circadian rhythm. It's been found to be beneficial when applied to cancer treatment, though, because when you're fasting for a few hours before and after chemotherapy, healthy cells benefit. By not consuming calories, these healthy cells go into survival mode and become dormant or inactive. Cancer cells are rapidly dividing and need nourishment to survive and grow, so they eagerly take up the chemotherapy and leave less for the healthy cells. The net result is that the patient experiences less toxicities like fatigue and nausea. Okay, these are complementary strategies that can be adopted. And I'm just going to go over them quickly because I know we have a lot to cover here. So massage therapy helps with anxiety, fatigue, and nausea. Hypnosis, so that perhaps you can ease your anxiety and pain by using that to prepare you for treatment. Guided imagery that I talked about, where you actually will envision your body eating up the cancer cells. Acupuncture is good to actually help with nausea, fatigue. Oral cryotherapy, using topical application of ice in your mouth to help with sores. Reiki, I had Reiki a lot when I was first diagnosed, and it was very, very helpful in my case. Aromatherapy also used for nausea, and it also helps stimulate your lymphatic flow. Supplements. These are some supplements. You can look at them on my website. Ginger, we talked about. Peppermint helps with nausea. Zinc helps prevent the taste that you might have. You hear people talk about taste changes I have during chemotherapy. Astragalus root can help with nausea and vomiting. Glutamine could help reduce peripheral neuropathy. Ginseng can reduce cancer-related fatigue. And guanara has been found to help with fatigue as well, especially in breast cancer patients. These are some things you can ingest. Blue-green algae like chlorella and spirulina actually are internal cleansers in your body. They can go in and pick up free radicals and basically give you internal cleansing. Kombucha is a tea that's fermented from mushrooms, and it's been used a lot and recommended for breast cancer patients. It was actually invented by a son of a breast cancer patient, and he invented it for his mom to use during her treatment. Mushrooms, you already talked about that, the chemo preventive effects, and it can help with nausea. It also enhances the efficacy of radiotherapy. And it also makes ovarian cancer cells sensitive to cisplatin. Astragalus root, again, they can bring their immune system back online. Because as we know, when you are going through chemotherapy, it sort of does a job on your immune system. So it's very important to support it. And bentonite clay is actually used as well. It's called the Great Detoxifier by the Sioux Indians. And it helps to remove the toxic byproducts of radiation. So how can we work together? How can the patient community and the medical community work together? I call it my three E's. Encourage patients to be partners in their treatment. Enlighten them with knowledge of complementary practices and empower them to be their own best advocate. Many patients are afraid to question their doctor, and no one is infallible and no one is God. And so you shouldn't feel that way. So I'm just hoping that that dialogue will continue, where patients will feel empowered to take charge of their own treatment. Okay, now I'm going to talk about, since I've been involved with clinical trials, let's talk about the elephant. I call it the elephant in the room, which is quality of life and dose regulation. So what happens in patient-reported outcomes is the patient reports back to the doctor when they're on a clinical trial, but that is only when they are going for an appointment. Well, a lot happens between appointments, and you may be feeling good the day you go to the doctor, And so that's what's fresh in your mind. What we feel is really needed is a simple way that patients on a daily basis could report to the doctor about how they're feeling that day, and have a list of symptoms, and then rate themselves from 1 to 10. And I actually did find an app that Pfizer had. It's called Living With, and it's free. And you could put in your information every day. And what would be awesome to have happen would be for that to get reported to your medical team. My husband has diabetes, and he has such a connection with his medical team. They get the results every day. So it's a much better, I feel, measure of what actually the patient is having for expected toxicities and also unexpected toxicities. They may give you a list and say you may have nausea, vomiting, whatever. But what about other things? Suppose you have things that are not on the list. You could also report that. And dose regulation, which is now a huge topic with the FDA, where the patient who is already ill does not always need to get the maximum tolerated dose. They're now looking at optimum tolerated dose, where they can find a dose that may not make the patient NED, no evidence of disease, but would maintain their disease so that it's not progressing, but would give them a much better quality of life. Okay. After treatment ends, this was really something that I did not expect. And in talking with breast cancer patients, it's really something that needs to be looked at. So when you're going through treatment, you're constantly really on a rhythm of going to treatment and appointments and everything else. But then when treatment is over and you're sort of told to go home and live your life, you are forever changed. I always talk about my life as BC and AC, before cancer and after cancer, because you can't forget what you've gone through, the trauma. And I know they've been behind you the whole time, but friends and family expect that when the treatment's over, you go back to the person they knew before, but they don't realize you're not that person anymore. And so I call it the post-breast cancer stress disorder. And a huge part of that is, will my cancer return? So some closing thoughts. Cancer is a word, not a sentence. So you are more than a statistic. It really is upsetting when you hear patients say, the doctor told me to go home and get my affairs in order. Or when they're diagnosed, my cancer only has a 5% chance of survival. Well, who is to say that you are not going to be part of that 5% success story? So please, you are an individual and you have your own, no one's cancer is the same. So believe in yourself and just be your own best advocate. And this is something that has just happened. I lost one of my dear friends last week, Dr. Vincent Tuohy. He was the inventor of the breast cancer vaccine at the Cleveland Clinic. And his motto was, prevention is the cure. When I was finished with my treatment, I was really, as I just discussed in the last slide, I kept thinking I should be grateful that I was over with treatment and that I had what was considered a good prognosis, but I was in a very dark place. And I read about Dr. Tuohy's work, and I said, if primary prevention can happen, I want to be part of this. And so I have been an advocate for Dr. Tuohy's work for the last 14 years, and his breast cancer vaccine is just wrapping up now in phase 1 clinical trials. So contact me. My email is sistersforprevention@yahoo. My website is sistersforprevention.com. 31, all of the tips I've discussed today, you can read about on my website. And I just again want to say thank you for the honor of presenting today. Here are some references that I used. And I'd be happy to answer any questions.
All right, everybody. Maybe we'll take one or two questions since we are getting close to time. Anybody have questions for Judy? Judy, I had a question actually. I know that I'll just ask it briefly. I know many of the strategies you suggested come from possibly your experience in your advocacy as a breast cancer advocate. But just to ask, I mean, how much would you recommend this to people who have other types of cancers or blood cancers or other kinds? Because some of them did seem to apply to other cancers. What are your thoughts?
Well, no matter what type of cancer you have, if you go on the premise that you're strengthening your immune system, then that's, we talk about immunotherapy. That's where we are headed. And the more we strengthen our immune system and the more we can train it to identify cancer cells, because everybody has cancer cells in their body every day, but the immune system catches them. And so you only develop the disease really when your immune system is somehow compromised by stress or anxiety, or again, what I talked about, chemicals in the environment. So I would think, of course, again, I'm not a medical professional, but I would think that any of these strategies would definitely help anyone that's facing a diagnosis of cancer.
Thank you, Judy. Okay, I think in the interest of time, we will go ahead and finish up our presentation. First, Judy, I wanted to thank you for that excellent presentation. That was really informative, and it was really powerful to hear your story and the stories of other patients throughout. That was really excellent, and I think everybody here will appreciate hearing that as well.
Thank you.
Now, and I wanted to thank all of you, the participants of this meeting, for joining us at CCP's first 2023 event on complementary cancer care from a physical health perspective. We really do appreciate your enthusiasm and participation in all aspects of this event. And we appreciate the viewers at home of this recording for taking the time to view this, the talks that are in this event. We can advance to the next slide. So this is part one. We got something else coming up soon. It's going to be complementary cancer care, a mental health perspective. You'll notice that a lot of what we talked about focused around the physical aspects of cancer care. We talked about exercise. We talked a lot about diet and pain and things like that. But we're also going to try and have an event in the future to teach attendees about approaches being used for managing mental and emotional side effects of cancer patients, psychosocial health side effects, depression, distress, anxiety, and all of that stuff. So be sure to keep tabs on our events if you are interested in attending this as well. But that's all that we have for you. Thank you all and have a good day. You're free to go, and thank you so much.